TRT World Health Correspondent Nicola Hill joins us now live from London. Good to see you, Nicola. Help us understand why the UK government has taken this decision. What evidence are they using to back it?
Well, they produced a graph and basically they were showing a risk-benefit profile. And they showed that if you were aged between 20 and 29, the chances of you actually having to go to intensive care unit because of COVID-19 were something like 0.8 in 100,000. But the chances of you having one of these blood clots, which they haven't confirmed as caused by the vaccine, but they say it's a plausible explanation, is 1 in 100,000. So because of that, they've decided that everybody under the age of 29 should have a different vaccine. And we've got the Pfizer one available, and then we've got the Moderna one coming on board as well. They have said it's not going to make any impact on all adults being vaccinated by this summer, but you do wonder that one. However, on average, for most people, the chances of having one of these blood clots is 4 in a million, which is just, absolutely tiny. So it's obviously a decision by the Joint Committee on Vaccine and Immunology, the JCVI, which is a government committee. It's not the medical regulator. They've decided that they want to be very, very cautious, and that's where they're saying that if you're under this age, your first dose should be something else. However, quite a lot of people working in the healthcare industry will, of course, have had their first dose of the AstraZeneca vaccine. And because they say they haven't seen any side effects with second doses, they're telling people to go ahead and then get the second dose. So it's confusing, and it's actually caused quite a lot of conversation on social media here, particularly because you can put this into perspective. For example, the risk of a woman taking the birth control pill, a lot of young women are on the pill, of having a blood clot is 1 in 1,000. So it's a much greater risk. Similarly, the chances of being knocked down in a car accident over 3 months is a much higher risk than that. And we all know the chances of taking a 4-hour flight or long car journey or bus journey also increases the risk of blood clots. So it has caused a lot of confusion. It was quite a surprising decision that the UK's done this. And that's really all I can say. We just don't know any more than that. And whether it's going to be a permanent decision or with all this further research that AstraZeneca has now been asked to do, this is what the EMA asked them yesterday, to do more research into the vaccine and any plausible link with these blood clots. So whether that might change the decision here in the UK afterwards, I don't know.
So that's the UK's decision with regards to under 30s. They're offering them an alternative to the AstraZeneca. What about other countries?
There is absolutely no consistent decision amongst the rest of the countries, and that also is quite bizarre, isn't it? And you do have to put this into perspective. The risk of getting a blood clot if you have COVID-19 is 30%. That's more than 30% of people hospitalised with COVID-19 get blood clots. So I heard one expert sort of say quite strongly, if you don't want to have a blood clot, don't get COVID-19, i.e. be vaccinated. But if we look at different countries, so different ones are doing different things. Denmark and Norway have suspended the use of the AstraZeneca vaccine. Australia says it's for people over the age of 50. In Canada, France and Belgium, it's over 55. In Germany, it's over 60. And they're also saying that people under the age of 60 who've had their first dose of the AstraZeneca vaccine should now have a different vaccine for their second dose. Now, that is quite unusual as well, simply because a lot of scientists are saying there's a theoretical possibility that you can mix and match these doses, but there haven't been studies that have been confirmed that this is a good idea, that it increases your immunity against COVID-19. So it's basically a question of looking to see whether eventually the EU health leaders are going to come together and have a consistent decision on this. In the meantime, the main thing that people are being told is get vaccinated, because obviously the only way we're going to prevent this third wave or fourth wave or fifth wave is to have some sort of control of the pandemic and for people to be immunised against COVID-19. And if you are given the AZ vaccine and you are worried, the symptoms to look out for are breathlessness, if you have swelling in your arm and your leg, if you have a persistent headache, and if you have blurred vision. But as I say, the numbers are tiny, 20 million doses here in the UK, 79 cases of blood clots. So you can see that the risk benefit of being vaccinated is much stronger to get the vaccine.
Absolutely, and that's an important message. Nicola Hill, thank you very much indeed.